Here we go. And good morning, PSWs and friends across Ontario and the rest of Canada and possibly the world. My name is Miranda Romanovich. I'm the CEO of the Ontario PSW Association and the Canadian Support Workers Association and host of PSW Podcast, where we come to you guys live every single Friday at 11 a.m., where we talk about the real deals of the PSW world. We air all the dirty laundry. We talk about the good. We talk about the bad. We talk about things that nobody wants us to talk about. That's what we talk about here on PSW Podcast. Yet again today, I am joined by the right side of my brain, Ian De Silva, who is our Chief Operating Officer of both OPSWA and CANSWA as well. And today we're going to be talking about retirement homes and PSWs. But I first want to start off this live both on Facebook and TikTok, where we're streaming, and address something that has become very obvious with the PSWs in Ontario and Canada. And that is a topic that we've been talking about a lot, Ian, about bullying in the workplace.
Yep.
And I just wanted to just make a statement to say that the association did not start the conversation on bullying so that people didn't want to be PSWs. Okay, this is not the reason why we did this. The reason why we brought it up is because it was like, your great grandmother's dirty secret that nobody wanted to talk about, nor have they talked about ever. And we brought a lot of attention and light to the issues. But the biggest thing that we did is by talking about bullying in the workplace and bullying amongst coworkers or administration to PSWs, et cetera, what we really did is we're putting the bullies on alert. We are outing the bullies and we're saying enough is enough. Stop with the bullying. Stop with the BS. There is no place for this anywhere in the world. And we really wanted also to, and I think Ian, you're going to agree with me here, is give the PSWs, make them realize that you guys have a lot of power. You guys can be the source of change in these workplaces in relation to bullying. So I just wanted to make that statement before we got started, and also to let everybody know that today, I believe today we're going to be launching our bullying survey. This is going to be located on our Facebook. I believe it's going to go out through our email marketing, and I'd appreciate it. You don't have to give your name or anything like that. We're just collecting data so that we can actually take this issue directly to the top, where the top would be is Queen's Park, and of course speak to them there about these issues to see if we can get some things addressed in relation to these. So yeah, if you see it, please fill it out. And now I guess, Ian, we start on our actual topic of what we are doing today, which is retirement homes and the PSWs. So take it away.
So retirement homes and the PSWs. So whenever we deal with PSWs in one workforce or one specific workplace, the PSWs that are not represented in that workplace raise alarms saying you didn't talk about us. So today we get a lot of questions. There's a lot of discussion right now about PSWs in long-term care and PSWs in retirement home, and the confusion between the two remains enormously present in our society. So just to give an overview, there are two major sectors in Ontario that employ personal support workers. One is, as we all know, the long-term care sector, which is run by the Ministry of Long-Term Care and Ministry of Health and the Government of Ontario. And then you have the retirement homes. The retirement homes are not run by the Ministry of Long-Term Care. They are generally privately held. There are not-for-profit ones, of course, but these are generally private care. PSWs, individuals pay privately for them, and they may or may not use PSW services, and retirement homes may or may not hire PSWs as part of their staff. Yeah. So in a nutshell, that is the situation as it relates to PSWs in retirement homes. So where do you want to dive in there? I think the differences are huge, but they're becoming closer to long-term care is what we've been seeing.
Oh yeah, no, absolutely. And I think that really kind of started over a decade ago, Ian, is where, initially retirement homes, it was kind of like the progress, right? So you would go from, having somebody come into your home, possibly, or you going into, hold on a second, because my sound is on my phone, and that's going to drive me absolutely wild if I don't get rid of that right now. Anyways, so, you typically had home care PSWs that would come in, and then you go into retirement. And because retirement, you just needed a little bit of assistance, you just needed a little bit of, of companionship or whatever you needed. You needed to be somewhere that in case there was an emergency, there was someone there to help you, but you didn't need the full-time care. And then from there, once they got worse, they go into long-term care. Now what we're seeing, because there's not enough long-term care beds, is we're seeing a lot of these long-term care patients, residents going into retirement homes.
Yeah.
And these retirement homes are not set up for these long-term care patients.
No, it's also the preference of the individual. They'd rather live in a retirement home in some cases. And for these individuals, they can afford it. For those who can't afford to do so, I'd rather live in a retirement home than go into long-term care, because they have fears of long-term care. Because long-term care is very institutionalized care.
Mhm.
We talk about it a lot being the residents and residents first. It's very institutionalized.
It's mini
It's a
hospitals.
mini
Let's be
hospital.
honest.
Well, let's
It's
be
mini
blunt here.
hospitals.
It's a mini
Yeah.
hospital. You're going into long-term care. It's very specific what you're there for. You need care. And it's also not just for geriatric care. This is now becoming the modern sanatorium, if you really will, for a lot of different areas where we can't support people. So I think we are seeing a lot more people resistant to going into those settings. Um, and as a result, those care acuity models are now showing up in retirement homes. So you have really weird interlocking of services that not are necessarily compatible. So it's a little bit strange.
Well, and we're hearing from a lot of retirement home PSWs that, it because it doesn't fall underneath, like you said earlier, it does not fall underneath any ministry per se. I mean, it sort of kind of doesn't. I mean, they are
Florida,
overseeing the
kinda.
ones sort of kind of the ones that are licensed
Yeah,
fall underneath the Retirement Home Regulatory Authority, which
yeah.
falls underneath the Ministry of Seniors here in Ontario. And so, they have a mandate to ensure proper care, proper oversight, the whole shebang, which is great. We love the RHRA. They do a
And
wonderful
they're coming a lot. They're doing amazing work recently in the last few years too. So it's
yeah,
this is not a comment so much on the current model, but things that we've seen that exist throughout
throughout.
ways
Yeah.
there. Yeah.
Yeah, I mean, I as a PSW, I never worked in retirement. That was I never. I was a long term care PSW and hospital PSW primarily, so I never worked in retirement. But hearing from our members, and especially when we talk about long term care ratios, and immediately people are like, "What about retirement homes?" So let's explain that then there for a second, because I think a lot of people think that kind of lobbying power that we have with the government in relation to publicly funded places also applies to retirement homes, and it does not. No. So what act do they fall under, Ian?
The Retirement Homes Regulatory Act. I think you caught me on that one.
Well, it's a landlord and tenant act.
Oh, the landlord and tenant. Okay, so that's what you're talking about, the administrative rules. Well, there is the RHRA, which governs the relationship, but there's also issues because you're a private renter in certain retirement homes. You actually are more protected under, and you're navigating under the Landlord Tenant Act. So this is before COVID. A few years ago, we saw incidents of PSWs that were privately. This is where you get some confusion and actually some conflict. And so a little bit of an anecdote. We have a PSW member that was working in a retirement home for a private client. So the private client brought this PSW with them from their home care into their retirement home, hoping to continue that relationship. Based on everything, there shouldn't be a problem with that. But that PSW, for reasons we don't know what happened, became kind of bullied by the administrators there. And then they decided to activate their power under the Landlord Tenant Act and say, you can't enter this building to get in to see that person that you've paid that's paying you for the care, because we don't have the power to let you through the threshold now. We've decided to rescind that. So
Hmm.
the PSW is like, I have a client, but I'm not allowed to enter the premises under this act, so I have to go home. That's the way
I
it is.
remember that. I
Yeah,
remember that.
that hasn't happened in a while, but I remember that being an issue for a while before COVID.
And
There's,
I'm sure that that's still happening. I'm
so
sure that has happened to some PSWs that are watching this, or family members. I mean, it's a different vibe. It's a different, like, so for transparency reasons, my mom lives in a retirement community. So you have, like, hers is not so much a retirement home. Hers is an adult lifestyle living, and that's another confusion, right?
it's a very
So
different situation.
very different. Like, my mom bought her condo. My mom owns that condo, and she lives in this gorgeous, I will say, retirement living where they have events and they have social get-togethers and they have everything on site. They have doctors on site, chiro on site, they have massage on site, they have everything on site for them. But it's kind of like a one-stop shop for those. My mom is 76. For those that are, getting older and may require more care. Now, once she gets to a certain point, she can pull from PSWs that work in the facility in the assisted living. They have an assisted living in the building as well, in order to do home care, basically for her if she requires it. But that's an added cost. So I don't think a lot of people understand the amount of money that people pay to be in these sorts of facilities.
No, and like you say, these are luxury facilities. They offer the best of everything. But
Hmm.
even the most luxurious facility with the most money cannot guarantee staffing levels. So
No.
just be warned. You can spend a lot of money. We deal with lots of members of the public that come in saying, I'm spending 12, 13,000 a month for care, for care from X, Y, or Z parent. And I can't get PSWs. The company's not giving them any. So
Yeah. Yeah.
money is
And
not
then
at
also, well,
this.
also too about retirement, right? So let's point this
We're
out.
talking about
In,
retirement.
yeah, in retirement homes, they don't have to hire PSWs.
No, they don't. No.
No, they to do care. They can literally hire Joe Blow off the street, give them a 1 day or 2 hour video,
Yeah.
on how to administer medications from the bubble packs, and that person is now,
Yeah.
giving out medications in the retirement home.
Which is fine. This is not a medical, and under the rules, that's completely fine. This is not a medical facility. These are community, this is a community care element. There's no oversight of who those individuals are working in the retirement homes, except for the supervisors and whatever union relationships you have and whatever associations are in there, including ourselves. But at the end of the day, your relationship as a resident of that retirement facility is between you and the managers, not between you and the government, not between you and society. It's a very private relationship, and that relationship is governed only through the RHRA Act. So you just want to be mindful about when you're going into these homes that we kind of switched onto the perspective of entering homes versus the perspective of being PSW. Sorry. But for those going into retirement homes, just be warned, not be warned, but be aware of what situation you're entering into. You'll get good care, but it's different than a long-term care. So
It's very, very different because there's
very
also retirement homes that are subsidized,
true.
right? That people pay next to nothing to live there, and unfortunately, the care reflects that in a lot of these retirement homes. But I mean, as a PSW, I think, like I said earlier, a lot of the confusion with PSWs that I'm finding what we're seeing when we post stuff about, healthcare in general or long-term care homes or even home care, that they immediately go, well, what about us? So let's answer that question. What about the retirement home PSWs?
Yeah, absolutely.
Yeah,
It's, it's completely different
yeah,
situations, and we got to address how these situations and those different situations are. There's a myriad of employers. There's a lot of private employers. You're governed under separate acts. You're more likely you're in the private delivery model world for the except even with the notwithstanding the subsidies. You're still in that private model world. When you're in long-term care, yes, you're in a private facility, but that's been run and paid for by the government. So it's different. It's very different.
right, very different. So I'll give an example of
Give an
why
example.
and
Yeah.
how this was different. Okay, so as everyone watching may remember that the association was successful in making a $3 wage enhancement mandatory, or it was permanent,
Yes. Yes.
back in the day, back through COVID.
Yeah.
And the issue with that was, we got a lot of flack from the retirement home PSWs because they were really mad that they
Uh,
did not qualify for this. So we're going to explain why. I've done it so many times over the years. You as a retirement home PSW, like Ian has explained brilliantly so far in this podcast, is you are working basically in private care. So this is not government funded care. This is private care, which means that the publicly funded money, which is a $3 wage enhancement, cannot be given to those homes because the government needs to follow the money. That is why. So that's why, like long-term care hospitals, of some community care agencies receive this $3 wage enhancement was because they receive funds from the government. So that's why you did not receive the $3 wage enhancement. And that's going on to the next topic of why are they paid so little?
Well, why are they paid so little? Because let's go back to what we were talking about. You're in the private economy. So this is a capitalist model that they have employed in the retirement home sector. And what that means is because the retirement homes can hire, as we said earlier, anyone essentially that they need, this increases the competition level for those retirement home jobs. Now, when you have increased competition for positions that don't require specialty, the wage falls. Okay. That's simple. So yes, you're a PSW, you have all the training, every course, you're ready to go. You have to compete against someone who says, yeah, I'm a PSW. I did the course last night online. I'm ready to go. You are equally competing against that person, equally, and they have an equal chance of that employment. And they will probably win in some cases because they'll say, yeah, I'll work for 17 an hour. Why not?
Exactly.
I'll figure it out. It's that simple, guys. So that's why we advocate so much for title protection. That's why we are encouraging, you want to make sure that the PSWs, when you're going into retirement home, that they are members of OPSWA, they're members of the HESCOPOA, that they're part of the regulatory structure that we're starting here in Ontario. So
Because at the end of the day, again, it's like it's about the people in these homes that require or may require the care of a personal support worker. And it scares me when you have, and they're called UCPs, which is unregulated care provider, because they have no title. When they go in, because again, it's to that whole idea that anybody can do the PSW job, that it's a really simple, it's not simple. Like I've been here, like we heard from some retirement home PSWs that they have full lifts in the retirement homes. They have people with dementia. They
yeah.
have, and they don't have the facilities in order to deal with this stuff. So they're coming up with, brilliant ideas on the spot in order to try to do their jobs correctly. I can't see someone that doesn't have that formal training being able to do that.
No, they wouldn't be able to do that.
No,
And
no.
and and then this is the next question. I mean, this is how do retirement homes. So they're in a speaking about a problem retirement home system is in, at least from my perspective, is yes, you're seeing an increased acuity levels of care, which means you have more and more demanding patients, essentially.
Yeah.
There's also limits in a lot of these contracts that say once you reach a certain threshold of care of care, we can't provide it. You have to leave.
Yeah.
That's another side of it. So yeah, they do have those things in place, but the question is, are they in there in place to be used or to give the idea that there's continuity? But I mean, I don't understand how that would balance out. I
I,
don't.
I think the retirement world, to be honest, is a really confusing world for a
I,
lot of people because there's just it's such a wide line of what they can and cannot do, and what they do and what they don't do, and it's kind of like, there's some boundaries need to be put up, I think, in a
oh yeah,
lot of ways surrounding these retirement homes. Because I mean, if you think about it, like I said, you have the subsidized retirement homes, the retirement homes like my mom's,
yep.
that these people can afford a lot of money to live in these gorgeous retirement homes that have like a five-star chef making food for them. You know what I mean? Which is great. I mean, she has a great time.
Seriously, great. I'm like, where
My
are you going with
mom's
this,
having a
Brandon?
great time.
Sorry.
Right? Like, it's doing well. But I mean, but then you have these other retirement homes where they can't get a lick of help.
Yeah, because it's again, this is a private sector. Retirement homes come from the private sector. They
Yeah.
developed for years. Originally, people. I mean, originally retirement homes were hotels. So if you ever
Yeah.
watch Faulty, if you ever you know the show Faulty Towers.
Yeah.
Yeah, if you watch that show, there are residents in that hotel that live there full time. That is their retirement home. You have the colonel and you have those two old ladies. They live there. That was how the original model started, is that you would rent a hotel room and then they decide to become a model. So retirement homes are demand based. So that's why there's such a disparity because not everyone has the same level of money, obviously. So it's just it's good to know about these things, and that's why retirement home wage is back to why it's so much lower, and the competition for those positions is so much greater, and it is simply the way the system has been naturally developed over the last century and a half. So just be just make sure you know that, I think is what we're
You
trying.
know, yeah, and I'm happy that we're talking about this too, because I mean, like I said, we don't, yes, we talk a lot about long-term care. We need to start talking more about home care, which we're on our way to doing that as well. Every single time we try to focus somewhere else, long-term care just kind of pulls us back in.
Because the
So
patient
many
goes through
issues.
all settings. I mean, that's the
Yeah.
thing. I mean, you have that patient, this is where we have to, the patient has choice now. Do you stay at home? Do you go to retirement home? Or do you just go to long-term care? There's lots of choices. You're very, I mean, we talk so negatively about what's going on healthcare, negative. But we've been making serious gains here in Ontario when it comes to promoting home care, aging in place. The
Yeah.
resources putting in place for people to do this are substantial.
Oh,
And
they're
they're not
huge.
that expensive. They're just practices.
Yeah, exactly. And the best
Oh,
part about it is that we're the leader in Ontario, across Canada
oh,
for
absolutely, yes.
these initiatives for home care, or even retirement homes. I mean, in our conversations with the RHRA, they're the people that are running the RHRA are phenomenal.
Amazing. Yes. No,
They
they're
actually are there because they give, they care. That's
absolutely.
why they're there. And I think where PSWs are concerned is if you are a personal support worker and you are working in retirement home in the province of Ontario, or hell, anywhere around across Canada, because we cover all of Canada, but if you don't have insurance, bloody get it. If you're working in the private sector, you
Yes.
need, especially need, to have the professional liability insurance. And this is not a pitch. I'm not trying to sell it to the people that are watching. I mean, you need it in every sector that you work in as a PSW. But as a PSW in retirement home, that's like a private working PSW going into someone's home and doesn't have. It's that same kind of concept of that same kind of level of possible shit
Well,
that can go down. Yeah.
no, and to that point, I mean, look at home care in Ontario. If you want to get home care in Ontario, you need to have a PSW that has 2 million in commercial liability insurance to get home care. And
Yep.
25,000 deductible. I mean, it's embedded in home care regulations, but it's not necessarily embedded in long-term care yet or retirement homes yet. So these are some of the things that I think we want to work towards because
Yeah, absolutely.
yeah. So it's we went all over the place, didn't we? We went into home care, retirement home, long-term care. We did the spectrum.
It was, and it will just be transparent with those watching. It was one of those PSW podcast guys that we didn't know what to talk about this week. Not gonna lie, we didn't want to talk necessarily about negative stuff, because a lot of the conversations we've been having lately are very much about the negative stuff that's been happening, in the PSW world. But the great part is, though, and I'm going to say this, is this week alone we've had so many compliments on PSWs. We've had so many people praising the PSWs on our social media platforms, when I go live on TikTok, that they really honestly, and some of these people, which amazed me, they had a PSW 10 years ago. And they still remember this PSW from 10 years ago and how much of a difference they made in their life 10 years ago. So for every PSW that's watching, and I know right now it's not easy. This whole country, this whole world is going through a lot of doo doo. But what you do on the every single day, that you go either to people's homes, you go into long-term care, hospital, retirement homes, assisted living, wherever the heck you work, you actually do make a difference every single day, because these people remember you. They remember how you smile at them, how you talk to them, how you address them. We hear from a lot of patients and residents and clients that at the end of days, and I used to hear it from my grandmothers, my omas, they feel like they're invisible as a patient, as a resident, as a client. And that was always their favorite time of day, was when the PSW would come, because the PSW really did see them. They felt seen. So, congratulations on that, PSWs, because that's not something that's taught. That's just something that is who you are as PSWs. So don't I don't I and if those of you that are thinking of leaving the field, and we've heard a lot about that, there's a lot of stressors, there's a lot of burnout, there's a lot of stuff happening. I understand that. Trust me. We all do at OPSWA. We really, really do. But there's other places you can work as a PSW. You
You guys
go,
have you're respected and you have a lot more power than you realize. And I
yeah.
think that's you do. And there's a lot of potential for this career in the next few years for sure. Just
Oh, there's absolutely. I
I
mean, there's
we
so
just
much.
don't want to come off as being so negative because we were looking at our posts, we're like, oh, we're bringing down. We're not. There are positives, and we want to work towards being more positive.
Yeah, and and I always say too, like if you have no reason to feel alone. That's why we're here. And I hear that a lot from PSWs that they feel like they're alone, like they have no one to turn to, and you have an entire professional association that you can turn to. And so you're not alone in the work that you guys do every single day on the front line in Ontario and Canada healthcare makes an impact, makes a difference. And if you guys, if we all left the field as PSWs, the system would absolutely crumble very fast.
Yes.
So
Well,
that's right
it,
there's the power.
yeah, it would double the burden of the nurses right away because the nurses would have to immediately take over all the personal care elements of all the populations in long-term care immediately.
Yeah.
That would be a,
We own it now. They can't take it back.
but it's still, it would be a massive disruption. So please understand, you guys are, we're working to make sure you get all the respect you deserve.
Absolutely. And it's not a quick thing.
No,
No, it's a forever thing, guys. It's going to be nonstop. That's what we've been doing. I mean, the association is over 15 years old. We've been doing this for a very long time, Ian and myself, and Nicole and the rest of our team. And it's a fight of passion. It's a fight of passion, and we obviously believe in all the PSWs in the province. But, anyways, I think we've had a great conversation, Ian, about retirement homes.
I just want to wish everyone a happy Thanksgiving weekend. I'm off now, but you can follow Miranda on TikTok after
Yes,
you're staying
yes,
on. So happy
yes.
Thanksgiving from Whitby to everyone that's out there today. Hope everyone has a great, safe weekend. Have and get some rest if you can. And for those who are working, you mean a lot to the people that you're in those facilities working with. Please understand that. Okay.
Yep. Thank you for saying that. I echo everything that Ian said. And I thank everyone for joining us again for another week of PSW podcast. Thank you so much for joining us. And remember, if you're not a member yet, go to www.opswa.ca, become a member. It's all tax deductible, and then you are protected upon becoming a member and you're a legitimate. So,
We
uh,
are stronger together.
yes, and we're stronger together. And with that, I'm going to say happy Thanksgiving weekend, guys, and OPSWA out.
Out. See ya.